Hello, I'm Dr. John Hinson of a Children's Dentistry Center in Carmichael, California. We're going to be talking today about some brushing techniques that you can use with your children or help teach your children. A couple of things before we discuss the technique. Number one is the selection of the brush. You should always select a brush that has soft bristles, nothing hard or firm, because those can damage the gums. And the second thing is whether or not to use toothpaste, and fluoridated toothpaste should only be used in patients who are not going to be swallowing the toothpaste. Very important not to have them use toothpaste that's fluoridated if they're swallowing the toothpaste. The technique involved in brushing, generally speaking, involves inserting the brush at an angle of about 45 degrees toward the gum and the tooth, because the gum has a small area of loose tissue right at the gum line that also needs to be cleaned. So we insert the bristles very gently into that area, do a small horizontal motion, and then finish by rolling the brush toward the direction that the teeth grow. So it's a small horizontal motion and then a roll toward the direction of growth of the tooth. On the inside surface, you'll probably need to change, at least in the front of the mouth, change the brush into a position similar to this, and then just move it toward the growth, the direction that the teeth grow. You probably won't be able to do the horizontal motion in this area because there just isn't room in the front of the mouth to do that. And the same with the lower teeth. You can do it on the back teeth. You can still do a little bit of a horizontal motion and then roll toward the growth direction that the teeth are growing. We want to avoid doing any aggressive horizontal brushing because that can damage the gum and over time can damage the tooth. So we don't want to do that kind of brushing. The surface in between the teeth is cleaned with floss. You can't really clean that area effectively with your toothbrush, but we'll cover that in a subsequent video on flossing. Thank you.